And I read this last line, and you wrote this, so I find it interesting talking to the writer about this. But the time is now for us to use what nature has made available, focus not on combating viruses, but instead on increasing our innate ability to heal, and call that progress. Now, he wrote that in 2013. Can you imagine if we took that to heart? Do you think we'd be in the position we are now in 2020, 21, 22, where we're fighting a pandemic and doing it this way, if we actually applied that medicine, applied that back then?
Yeah, I mean, to me, and I'll be very honest, like I don't have a broad spectrum opinion on vaccines, on like, is this positive or negative?
Sure.
My outlook on it is really, I think for some individuals it's absolutely appropriate. Obviously, if someone is high risk, if they're going to be around a lot of people, like absolutely, in that case, it absolutely makes sense. I guess what I would want to see pretty much across the board, or really make sure, if I could have any say in how people are treating themselves and how the state of medicine is being practiced, it's that let's do what we need to do to solve the problem in the immediate, to treat the symptoms. We're not opposed to treating symptoms, but let's not lose sight of our body's own healing nature. Let's not lose sight of doing the things that we can do on a daily basis. Pretty simple practices, right? Like some lifestyle stuff, reducing stress, changing even our mindset to, change our stress response, proper nutrition, good sleep, all these things that are not new to anyone, but that we so overlook. Let's not lose sight of those simple things that we can do to really help ourselves out long term, so that when we use these tools that that doctors and pharmacies and technology creates, a lot of which are extremely valuable, that we're not using them as a crutch, but we're using them to enhance ourselves or to bridge that gap so that we can resume our best way of life.
And they are tools at the end of the day. And tools by nature are neutral. It's what we do with them, it's how we apply them. We always talk about this when we kind of, discuss whether something, like you said, is good or bad, right? Is
Mm-hmm.
a surgical knife, scalpel, good or bad? Well, in the hands of a trained surgeon doing a surgery that is required and life saving, it's an incredibly positive tool. In the hands of someone who doesn't know what they're doing and nicks an artery and kills you, you're a murderer. That's not, that could be seen as a negative side of it as well. And everything has that, whether it's pharmaceutical, drugs, or even nature has that polarity to everything. And I think you got to find yourself in that gray, in that middle ground of it all, to not demonize pharmaceuticals, vaccines, anything. They are necessary, but to
Yeah.
also understand, how do we look at that more long-term natural healing side that we all embody within us? How do we appreciate both? How do we find ourselves saying they're both necessary? They're both there.